Number 1. Must submit an application to operate a nursing home to which entity? AHCA or FL Department of Health. Number 2. True or false, potentially hazardous foods such as egg salad or potato salad must be prepared from products kept at room temperature? False. Should be prepared from chilled products. Number 3. True or false, a thermometer should be placed in the coldest part of a refrigerator or freezer? False. The warmest part. Number 4. True or false, an emergency medication kit must have an inventory of its contents kept inside the kit? False. Must be attached to the outside. Number 5. True or false, an emergency medication kit must be sealed with a lock and key? False. It is sealed with a wire loop through a plastic tab to detect when someone has accessed the kit. Number 6. The Quality Assurance Committee must meet at least every how often? Every 3 months or quarterly. Number 7. How often must the attending physician see their residents or patients in a nursing home? Every month for the first 3 months and then every other month thereafter. Number 8. What is the grace period for a required physician visit? 10 days. Number 9. A facility is or is not required to commingle resident trust funds and facility accounts to reduce costs? A facility cannot commingle or mix facility funds with resident funds. Number 10. The facility must inform residents of their bed hold rights at least how many times? Once upon admission and then again upon transfer. Number 11. Where should the facility license be displayed? In a prominent public place like the lobby. Number 12. Where should the facility post copies of their survey results? In a prominent public place. Number 13. A facility must keep their survey results for how many years? 5 years. Number 14. True or false, a private pay resident may pay for a bed hold for a maximum of 14 days? False, 30 days. Number 15. The administrator is responsible to provide a resident an accounting of their trust account fund how often? Quarterly. Number 16. Must notify AHCA how many days prior to selling a nursing home? 90 days. Number 17. Must notify AHCA how many days prior to transferring ownership of a facility? 90 days. Number 18. An administrator must notify the Board of Nursing Home Administrators in writing within how many days of leaving or starting work at a nursing home? 2 days. Number 19. True or false, a nursing home can operate a geriatric outpatient clinic within a distinct part of the facility? True. Number 20. Which payment source would pay for a bed hold? Medicaid. Number 21. True or false, Medicare and Medicaid will pay for a bedside telephone? False. Number 22. True or false, Medicare and Medicaid will pay for a private room? False. Number 23. True or false, Medicare and Medicaid will not pay for television set in the resident's room? True. Number 24. True or false, when a facility is sold or transferred, the seller will not be held liable for Medicaid overpayments during its operation? Number 25. A nursing home must be surveyed by the state at least how often? 9-15 months. Number 26. A facility must report the total number of all grievances they received to the state how often? Annually on the facility license renewal form. Number 27. A facility must submit staff to resident ratios to AHCA how often? Quarterly. Number 28. If a facility does not meet state minimum staffing requirements for 2 days, the facility cannot accept new admissions for how many days? 6 days. Number 29. A facility can have a medical consultant in lieu of a medical director with how many beds? 60 or less beds. Number 30. Resident care policies must be reviewed and approved by whom? Medical director. Number 31. A medical director may serve a maximum of how many facilities at the same time? 10 facilities. Number 32. Must post a trust fund surety bond equal to twice the average monthly balance in the resident trust fund or a minimum of many dollars? $5,000. Number 33. Cold food must be served at what temperature? 41 degrees. Number 34. Must have an assistant done in a facility with how many beds? 121 beds or more. Number 35. True or false? Each resident admitted to a nursing facility must have physician orders that cover medications and treatment and diet? True. Number 36. New nursing home residents must be seen at least how often by their attending physician for the first 3 months? Every 30 days. Number 37. The disaster preparedness plan must include a plan for which types of disasters? All types of disasters. Number 38. How often must the disaster preparedness plan be submitted to the County Emergency Planning Office for approval? Annually. Number 39. Which entity must approve the facility fire plan? The local fire department. Number 40. Monies deposited with a self-insurance pool must be deposited into a commercial bank chartered in which state? Florida. Number 41. True or false? A facility is required to pay for routine transportation costs for residents? False. The facility is required to arrange transportation but not pay for it. Number 42. True or false? A facility is not required to pay for routine dental care? True. The facility is not required to pay for routine dental care, only to arrange for dental services and transportation to and from doctors' offices. Number 43. The food service permit for the facility must be renewed how often by the local health department? Annually. Number 44. The food service permit must be renewed on which date? September 30th. Number 45. Any willful or threatened act by a caregiver that causes significant impairment to a vulnerable adult is called what? Abuse. Number 46. Failure to provide services or care required to maintain physical and mental health is called what? Neglect. Number 47. Using a position of trust to obtain assets and money of a vulnerable adult and use it for someone else's benefit is called what? Exploitation. Number 48. Fondling and exposure of sexual organs or using a vulnerable adult for prostitution is called what? Sexual abuse. Number 49. True or false? State and local enforcement officials may only request access to the facility and facility residents during regular business hours? False. They have the right to enter the facility at any hour. Number 50. Explaining to a resident a course of treatment. Possible side effects and alternatives.